how do you treat a bladder cancer? So, the treatment in a cancer of bladder depends on what type of cancer is it. Is it superficial or non-muscle invasive, or is it deep? Superficial cancers are easier to treat. You shave it off and then you give periodically some chemotherapy into the bladder, or BCG, which is put into the bladder. That is the only real treatment actually involved. In the patient on follow-up is asked to come every 3 months. We put a telescope in the bladder and look if there's a tumor coming again, because sometimes they do recur in spite of your therapy. So the treatment is bladder chemotherapy, giving the drug into the bladder, and that's it. The patients who have got a muscle invasive disease, in those patients you need to go aggressive. Most often we use a combination of chemotherapy given for about 3 or 4 cycles, and then we take out the entire bladder. So it is called radical cystectomy. The reconstruction, which is making a new bladder or neobladder, is done with a pouch made of gut loops. With this, the patient is able to pass urine through the natural passage as he was doing earlier. In some patients where the disease is very advanced, we cannot do a neobladder. We make a small tube which comes out in a hole in the abdomen and put a urine bag there. It is called ileal conduit. So this is how we treat a bladder tumor